you're watching this video right now and you're trying to determine whether or not you want to go this route, I call it hardcore holistic nutrition. Just keep in mind what you've been through so far, what's worked, what hasn't worked, and the people that come to see me or see the practitioners in this office, they've already been through the whole medical system, and they've gotten the results that they've gotten, and they're not happy with it. And so they're thinking to themselves, I want to feel the way I used to feel when I was 20. Or I want my kid to be as healthy as they possibly can. And they can see the sort of defects in their body functioning, resulting in symptoms. And you know that there's greater potential. And you know that that potential comes from working with the body instead of punishing it with drugs. And you're demanding help at this moment. You're like, I need help. Who's going to help me? The best answers come when you're working with the body. And we are the ones to supply the best second opinion. So there's patients that get an opinion or a diagnosis from a doctor, and they go to another medical doctor for another diagnosis or a second opinion, and they get the same exact diagnosis. Or even if they get a different diagnosis, the treatment is the same. Steroids, antihistamines, antidepressants, antibiotics, anti-this, anti-that. The anti means against. And so you're taking drugs that are against something in your body. Instead of enhancing the function of the organs and the systems, which is what we do, that's how people get better so much easier and faster, by enhancement instead of squashing, or instead of suppressing or killing. And it's still valid, of course, to do an antiviral medication or an antibiotic to kill bacteria. Or there's some people that they need the antidepressant. You know, there's a lot of appropriate usages of medical therapies. But in the majority of cases, actually, the first step should be nutrition. Hardcore holistic nutrition. Not just going to a nutritionist and being told to eat a high-fiber, low-fat diet. Not the standard American like food pyramid sort of style of nutrition advice. Not that. The science behind that is zero. There's a lot of surveys to back up the food pyramid or the USDA dietary guidelines, formerly known as the food pyramid. But those are surveys. Surveys are not science. The science actually takes an experiment. Science actually requires an experiment where you do something to a group, and then you also have a placebo. And you also have a control group where you don't do anything to that control group. Science requires a certain set of parameters, whereas the surveys are not scientific. So more than 90% of nutrition studies are not science, they're actually just surveys. So I'm looking at the science, and then I apply it to my patients, and we look at the results, and we get those results. It's been fantastic. It's been a lot of fun having this kind of a practice because the results are so good.